My name's Sydney. I'm the PA here, which stands for physician assistant. So I help out doc and see patients. Whenever a patient first comes into the clinic, I do their history, their physical exam, just like you would at a standard doctor's office. I know we had kind of talked about how it's a little bit more extensive instead of that 15-minute quick appointment. I often spend about an hour with a patient on their first history and physical exam. If any scans or testing is needed at that time, I'll order those. I do the Imago on them on their first week, which is a frequency machine that looks at how their body is functioning on a frequency level. Every week we do blood work on the patients that are here, so I go over all of their blood work with them every week and kind of go from there. If they have any questions while they're here, Dr. Garcia and I both have an open door policy. So if our door's open, we're available for any questions. A little bit more autonomy, so we can order, and we are also able to order testing. So I order all testing, we can evaluate lab results. We can write prescriptions, things like that. We can essentially do everything that an MD or a DO can do, except we just need the supervising of an MD or DO. So in certain states, they want you to check in with the doctor anywhere from 1 week to every couple months. It just kind of depends on where you are. Here, Dr. Garcia is here daily, so Dr. Garcia and I talk about pretty much every patient that we have. There are a lot of facilities you don't get to talk to your supervising physician much, so it's just another set of minds. If I have a question or he has a question, we can kind of collaborate together and figure out the best option for a patient and what they need. And I just think overall patient care is better and more well-rounded because of it. Well, I think Utopia has we have everything. We have a counselor on staff, we have an herbalist on staff, we have different therapies here. It's just a very well-rounded program that gives someone a lot of options to succeed. As long as we don't have something on our schedule, I mean, they can hang out all day.
It sounds like they do sometimes.
Yes, sometimes, yep. Yeah, but if they have any questions about their care, a lot of times I'll go over their blood work. They'll go home, they'll talk to their spouse, their children, their parents, anything like that. And then they come in and they're like, listen, I have more questions. Then we can go over that again. That happens a lot of the times with scans also when we get imaging results back. We go over it the first time, but then they go home, read more about it, and do their research on Google, of course, and then have a few more questions. Here at Utopia, we really do care about our patients and have their best interest at heart. We welcome everyone that would like to come here and definitely at least come for a consultation with Dr. Garcia and see what we have to offer.
And how much do those consultations cost?
They are complimentary. For cancer patients, yes, they are complimentary.
Fantastic. That's great news. There's really no reason not to at least have the consult.
No, and more opinions are always the better, I believe.